In the era of extreme climate trauma, the new babies are communicating their crisis with their first cry from extreme heat waves. This is the global emergency. This is the time of dangerous impact of climate scenario in the earth, from global south to global north, from South Asian countries like India, Bangladesh, Pakistan, Bhutan, from African countries like Sudan, Morocco, each and every part of the world, the people are facing crisis, the mother are facing crisis, the pregnant women are extremely under trauma from extreme heat waves. We have to think something more positive, more action oriented for upcoming generations and upcoming picture to save a better world, to save the world what we have actually. Today, I'm going to discussions about regarding the protection parameter, the crisis, the impact of the pregnant women all over the world, and the global economic perspective, which is impactful from all over the world, and each and every part of the developing countries. They are facing climate crisis, they are facing coastal issues, they are facing sea level rise. When I was discussing about European countries, in London, people were facing extreme heat waves, almost reaching more than 33-degree temperature, which is bigger than more than 150 years of crisis. Women were requesting in their working zone there should be a particular action-oriented scenario. There should be a particular plan for the upcoming days. What should be the plan? What should be the upcoming ideology to maintain a security of newborn baby? Who are the future of the earth? What should be the upcoming day, upcoming strategy for the pregnant women? We all know the first crisis from the scenario is healthcare issue. The health issues. Why is the hygiene parameter should not maintaining the proper issues in the each and every country? Is this a particular joke to discussions that regarding on the scenario that this is the climate parameter? We have to think something bigger on the regarding of particular health issues, particular health parameter, and also the maintenance of hygiene and the different parts which is actually facing the climate trauma where climate victims are extremely high. I was in 2021 in Sundarban where people were facing extreme climate crisis regarding their discontinuity of connectivity from the peoples who are actually in urbans, and they are facing in the crisis in the islands, because we all know in the Sundarban issue there extreme climate disaster, the sea level rising high, that the islands is going down underwater, and more the climate refugee categories are growing. Then what should be the planning of hygiene issues, the health issues for the upcoming women? What should be the hygiene issues for the pregnant women, for their babies? So the planning, the protection, the parameter, everything, the strategies should make something bigger. The first thing, definitely the medical monitoring, which is very, very important. The regular parental checkups, especially during heat waves. During heat waves, there should be a proper count that how many pregnant women in particular community lives in the extreme heat waves where it's more than 40-degree temperature. What are their crises? Are they stay hydrated on the scenario? Is there drinking water, avoiding surgery as caffeine drinks? So they are actually using fans, air conditioning, shaded areas, or public cooling area centers? Is there anything on the regarding on this? There should be a particular restrictions that this is the time you can't go out from the room for extreme heat waves. Suppose at the time of 10 a.m. to 4 p.m., the hottest hours, and they're taking their rest. We all know there is a bigger impact on the agriculture issue where the woman and the pregnant woman would actually, by default, they have resourceful connectivity and the economically connected with the agriculture. They know they have particularly their daily life routine, their daily work. They should work for the agriculture development. They should plan for something farming. But the thing is that what should be the particular time to visit the agriculture land when the temperature is reaching more than 40-degree temperature? That should be the particular things. When World Bank has already declared that by 2030, more than $2.4 billion of dollar, which $2.4 trillion will going to lose for the extreme heat waves because the women are facing extreme climate crisis or the heat waves. Many government, many countries, many particular NGOs, community development groups, they're actually not planning on the particular scenario regarding this part. When we all know that we have less than 90 days for COP30, this topic should be discussed on the bigger purpose. As per my ideology, there should be a community build-up goal, community measurement, each and every part where climate victims are extremely in the crisis. This is not about the Sundarban area. This is about the African countries who are actually in the climate crisis. The animals also will face this kind of heat waves and they have died. So what should be the plan for the extreme heat wave scenario or the risk of dehydration, the low birth weight and the maternal complications? What should be the plan of health strategy and the climate strategy equally parallelly go in the better part? This should be the planning or the upcoming days, and there should be the particular workforce productivity. There should be each and every work area, work zone should be particular parameter, particular structure for the upcoming days, for the women especially who are pregnant. Their food structure, their community development, their medical measurement, their upcoming days structure, their thinking and awareness what they are thinking. Are they in stress, extreme stress? Are they in extreme depressions on the regarding of heat waves and the climate crisis? So this is the time to think. This is the time for global activity. This is the time to something more about when we are discussing about increased poverty and inequality. The countries like West Asia, countries like low-income regions, women in low-income regions is Africa and South Asia, facing higher risk because of lack of cooling infrastructure. Is it true that the developing countries who are actually facing crisis in the farthest more corner of the developing countries who have actually not electricity also, how they will maintain this cooling structure? They are facing their pregnant trauma at the time of climate crisis and the disaster scenario of extreme heat waves. They are losing their lands. They are losing in the sea level rise. They are losing their lands in landslides. They are losing their farming lands in landslides. And what another crisis is unusual climate disaster, the extreme rainfall, the flood scenario. Because this is the families they are spent on medical care who's in vulnerable household. So this is the time to think. This is the time on global economical purpose, national economy, and the generational economic purpose on the cost in more on healthcare purpose or for the productivity, for also education. Women should educate on the climate education this time. The pregnancy and the parallel climate education will grow up and the better purpose on at the time of delivery system, at the time of delivery of the babies. Many more countries, many countries who the babies at present facing low weight, unusual health issues at the time of birth, thalassemia, and another losing of proteins, and also the unusual body weight, which is extremely in crisis, even on diet. So this is the crisis at present from the global issue, from the climate issue, on the impacting on the same scenario. So we have to think something more positive regarding this. This is my viewpoint on the COP30 members, on the global declarations, on the policy member. Think about something on the pregnant women as purposely there should be a development on education, healthcare, resources, and what their job role. That will helpful for the upcoming days by 2030. And this is the time to think. Thank you.